This webinar, focused on the Under 16 Cancer Patient Experience Survey 2020, was recorded on the 2nd of December 2021.
Brilliant, thank you, and welcome everyone to this afternoon's event. It's really great that so many of you have been able to take time out from what's an extraordinarily busy time for the NHS at the moment to join us, and so welcome. I wanted to begin by saying a few thank yous. The Under 16 Cancer Patient Experience Survey, has been a long time in the gestation, and I'm sure many of you will have been involved in its development. Cancer charities, we're going to hear later from Young Lives versus Cancer, but other cancer charities, Teenage Cancer Trust and others have been closely involved in the development of the survey, as have patients and carers, and of course children themselves. I'm really grateful to colleagues in the team. This straddles Neil's team and my team within NHS England and Improvement, and also huge thanks to the team at PACA who have PICA who have led the delivery of the survey. I thought my mind was drifting to cricket then, I think, with the reference to PACA. So I do apologise to colleagues from there. I think I'm right in saying that that testing the views of child cancer patients and their families was first sort of floated as an idea back in the 2015 National Cancer Task Force report, and we have been, we've run the adult cancer patient experience survey for around a decade now, but the publication of the first results from the Under 16 Cancer Patient Experience Survey was the first time that we've been able to collect views and publish views from what is a sort of mercifully small but very important group of patients. But I think it's worth reflecting on the process and the time it's taken to get us to this point. And I'm really impressed with the professionalism and the skill that has gone into developing this survey, running it, and then publishing the results. And I wanted to put on record my thanks to everyone for that today. It's even more extraordinary that we've been able to do this despite all the additional pressures of the pandemic over the last year. And I think it really underlines the commitment of everyone involved to making this happen, that we've been able to do so against such a difficult backdrop for the NHS. And the results really are quite extraordinary. On the slide in front of us, you can see a sort of very headline summary of what the 1,100 or so respondents to the survey told us. Parents, carers gave an overall rating or an average rating of 9.2 for their child's overall experience of care. That is an extraordinary result in many ways. I was Googling ahead of today, and I found online a thing called the UK Customer Satisfaction Index, which is a sort of biannual assessment of customer satisfaction for all sorts of private sector, public sector organisations, which is published by the Institute of Customer Service. You can look it up, and guess what the top 3 companies in the UK Customer Satisfaction Index for July were? Anyone want to guess? It was a mistake to try and make this interactive, I realise. I will tell you. In 3rd place was Amazon. There you go. Whatever you think of Amazon, they had a customer satisfaction rating of 84%. In 2nd place, John Lewis. As I commented at the last thing, it must have been quite. I think the people they surveyed were obviously quite a middle-class bunch for John Lewis to come second in the UK Customer Satisfaction Index. They had a rating of 84.4%. And anyone guess who was top? It was First Direct, the bank. They always seem to, a good Yorkshire institution, they always seem to come top in all of these customer satisfaction indexes, and they had a customer satisfaction rating of 86.6%. If you turn our 9.2 out of 10 into a UK customer satisfaction index percentage, we would be on 92% for children's cancer services. So not only would we have come top, we'd have come top by about 6 clear percentage points. And I think, and I would just, I know we've got colleagues from various children's cancer services on the call from around the country. Please tell all your colleagues this, and just thank them for this extraordinary achievement, this extraordinary vote of confidence in the quality of the care that you're providing to children and their families. Because I think, particularly given the year we've just had, we can all be enormously proud of that. And I think it is an absolutely extraordinary achievement. That's not to say that there aren't some serious messages in the survey that I think we need to think about and reflect on, and that's fundamentally the point of this survey. There are some important messages, and we will begin to sort of talk about them today, about how we communicate with children and their parents about their diagnosis and their treatment. There are some messages perhaps in there about one of those perennial issues facing us in hospitals around handovers between staff and patients, their parents feeling their need to repeat their case history time and time again. And then there are some questions for us to reflect on in there, perhaps around how ready the access is to advice and support, even out of hours, when parents or their children feel they need it. But I think that's why we worked on this together. That's the important thing, because I know that you all share a passion and a determination to provide the best possible service to child cancer patients and their families. And it's the Under 16 Cancer Patient Experience Survey and the messages we're getting back from the people that we're here to serve that will enable us to do that better than anything. So thank you for taking the time out today. I hope you find this afternoon's session valuable, and thank you again for all you're doing to try to improve the service we provide to this very important part of our community.
Thank you there, David, and welcome. And there's something in the chat that we've been talking about this since the 1990s, having an under 60s cancer survey there. So
it's a heck of a milestone. It's and we may have been talking about it, but lots of the people on this call have actually done it now, and I think that's the thing. Again, I hope everyone feels really proud of this achievement, and and we can build from here.
Well, let's get into some of the results and some of the data here. Amy, do you want to take over?
Thank you, and thank you, David. So my job today is to talk you through some of the key findings. I know David's touched on a couple of those just now, so I hope to walk you through some of the key survey findings in a little bit more detail. As Hanan mentioned at the start, feel free to post any thoughts, queries, anything that surprises you in the chat, and feel free to pick up some discussions there as I talk through. Okay, just a brief intro then. So the Under 16 Cancer Patient Experience Survey measures the experiences of tumour and cancer care in children under 16 in England and in that of their parents. The first iteration of the survey has just completed and reported on in October, and that's what we'll be presenting to you today. And the survey enables principal treatment centres, or PTCs, to collect and understand their own results locally and also compare against others, as well as having this broader understanding of what care looks like nationally. We've got a fantastic advisory group who they advise on survey methods, on the questionnaire content, on reporting approaches. And we meet around quarterly, and I know there's a couple of representatives who are on the webinar today, and Sonia is one of those who will be talking a bit later to you. Just in terms of the methods, very briefly to touch on. So anybody that received cancer care at a principal treatment centre who was aged under 16 in the year of 2020 was actually sent a questionnaire in the NHS in England, was sent a questionnaire for this first survey wave, and they were posted a survey invite and a paper questionnaire. But there was also an online option, so they could go online and complete a survey accessed via a URL or QR code. 3 versions of the questionnaire. Firstly, a parent's version for 0 to 7-year-olds, and then 2 children's versions, 8 to 11 and 12 to 15, each with a section for children and a section for their parents to complete. The fieldwork took place between April and June this year. Sorry, this is quite a text-heavy slide. There's just a couple of things I'm keen to point out here. Firstly, it's to protect identity of respondents. Any data reported by groups of size of under 11 has been suppressed. And really, sort of most importantly, is flagging the COVID context. So the survey sampled patients who received care in 2020, and we all know that 2020 was a very different year for the NHS. So it is likely that to some extent COVID impacted care and impacted how people may have answered the questions on this survey. So they're just some things to keep in mind. Okay, I am going to jump into the results now, so to talk you through some of the key findings. Response rate. So overall, we received a 1,144 completed survey responses, which is fantastic. It was a 35% response rate of 3,308 eligible people sent the survey. We've got a few breakdowns to give you an idea about the demographic profile of respondents. So firstly, age. So we're looking at the respondents by survey type here. We received 54% of all completed surveys were from the parents of the 0 to 7-year-olds, and 23% from children aged 8 to 11, and then further 23% from 12 to 15-year-olds. And this was actually reflective of those who were invited to take part. So there was a greater proportion of 0 to 7-year-olds in those who were sent a survey. A few further demographics. So we've got gender and ethnicity here. So in terms of ethnicity, of all respondents, 78% were from a white ethnic background, and 18% in total were from a mixed Asian or Black background. Again, this reflects the population who were invited to take part. We've actually looked at response rate by ethnicity. Sorry, Hanan, I can't see the chat, but I think you'll be able to post the response rates by ethnicity into the chat for reference. But there wasn't a huge variance or a huge difference in the actual response rate by ethnic group. So Hanan can share those figures with you. In terms of gender, gender of child, 56% male, 40% female, and a few that preferred not to say or didn't answer that question in the survey. And again, it is reflective of the people who were invited to take part. There were slightly more boys in the sample than girls. Okay. We split the results into various sort of topics or subheadings, so to talk you through different parts of the survey. The first being about the diagnosis, so what we call in the survey finding out about the cancer or tumour. I'd just like to take a moment to talk you through the format of these results, and as you see a chart, what to expect and what to look for. So for each chart I present today, you'll see a title, which is the actual question wording that as it was asked in the questionnaire. The bars show the response options. So for this question, you've got 1, 2, 3, 4, 5, 6 response options along the bottom, and then the actual bars and the different colours themselves are different groups of respondents. The orange or mango coloured bar is always going to show you the overall score, the overall percent, the data for everyone who answered that question in the survey. We've tried to, where possible, split the data by survey type or age group as well, to give you a bit more insight as to whether there were any age differences coming out of the survey. So let's take this question first. So before you were told your child needed to go to hospital, how many times did they see a GP? You can see that 36% went straight to hospital, 22% saw a GP once. There were some differences by age group or survey type, where parents or carers of 0 to 7-year-olds were more likely to go straight to hospital or to see a GP only once, relative to all of their age groups, with the 8 to 11s and the 12 to 15s, as you can see by the difference here. Okay. So communication at diagnosis is obviously critical that we get this right. So for those who were diagnosed in the last year, we asked them several questions about communication. As you can see from the top, 82% of parents and children said they were definitely able to have their questions answered when they were first told about their cancer or tumour. And the bottom one, you've got 70% of respondents were definitely given information in a way they could understand at the point of diagnosis. It's always useful to think to sort of flip these results the other way as well. So although 70% might seem quite a high percentage, that's still a gap of 30%. So it means that actually there was 30% of people that said they weren't definitely given information in a way they could understand when they were diagnosed. Okay, a couple of questions on healthcare staff. So the survey asked parents questions about how they were treated by healthcare staff. A couple of questions, results for a couple of questions are displayed on this slide. The first one, respect and dignity. 89% of all parents said they and their child were treated with respect and dignity by staff, and 86% were treated with empathy and understanding. So some really positive results there. Again, you've got very few saying no, which is fantastic, that this did not happen, but you've got some saying, well, it only sometimes happens. So there is a little bit of a gap to address there. A few further questions on communication. So we've got communication with the child in the presence of the child, and communication with the child directly. So parents were asked whether staff were sensitive to the information shared with them when their child was present. Only 2/3 or 68% said always, which is this orange bar here. And you can actually see the older the patient, the more likely that parents or carers would say that staff were always sensitive to the information that was shared with them when the child was present. So it got worse for the younger groups. And for the second one, we've got 89% of children children themselves felt that staff were always friendly, and there was no difference between the 8 to 11s and the 12 to 15s there. Communication with children. Obviously, it's critical that children understand themselves what's happening with their treatment and care and diagnosis. So we ask about these in the survey. Older children were more likely to report that staff always spoke to them in a way they could understand. So it was 69% overall, but 76% for children 12 to 15, but only 63% of 8 to 11s said they always understand what staff are saying. So a slight sort of drop in performance for 8 to 11s there. It might be just worth considering perhaps in the chat what could be done to improve communication with 8 to 11s, or does this difference surprise you? Is it something that you see or you hear of in your places of work? Oh, sorry, moved on too fast. And then just a couple of other important communication questions here. So 84% of children aged 8 to 15 said that staff always spoke to them in a way that was suitable, and 79% said staff always talked to them, not just to their parent or carer. Again, I'm going to flip that the other way and say that's still 21% of children saying that staff only sometimes or did not at all talk to them instead of their parent or carer, and that's 8 to 15. So I just wanted to highlight that one in particular there. Okay. Support, obviously support's critical for both children with cancer and their wider families. So we were keen to ask this and cover this in the questionnaire. This slide shows data from a question about support that was asked to parents and carers, and the question itself is worded asking about the extent to which hospital staff signpost parents to various sources of support. What we found is that 87% of parents overall said they'd been signposted to support from charities such as Click Sargent, now Young Lives versus Cancer, or Macmillan. And 57%, so a lot fewer, had been signposted to a psychologist or counsellor support. This was actually lower for parents and carers of 0 to 7s than the 8 to 11s and the 12 to 15s in terms of signposting to psychological support, as you can see here for the differences. A very similar question was asked to children directly, children aged 8 to 15. What you can see here is that 77% of children aged 8 to 15 said they were given information about charities, but only it's a similar pattern to the parents' question, a fewer proportion, only 56% were given information about psychological support. No difference in terms of age groups by signposting to charity support, but there was a bit of a difference when we're looking at differences between age on the psychological support signposting. So you've got only 53% of 8 to 11s were signposted versus 59% of 12 to 15s. And again, it might be worth considering, you know, why do you think there is a difference here in the age groups? Is there a reason for this? Is there anything we can do about it? Wider questions on support then. So we've got one about access here, an important one about access, and only 60% of parents, carers felt that they definitely could access reliable help and support 7 days a week from the hospital. And some slight differences by age, which is interesting, where it's more poorly rated by parents, carers of the older children. Ongoing support seems really important to children with cancer and their parents. And of those parents whose treatment had finished, only 57% said they got ongoing support from the hospital after the treatment, their child's treatment had finished. And this was slightly lower for parents of 12 to 15-year-olds than for the younger age groups, the 0 to 7s and the 8 to 11s. The child's care and treatment then. So we ask a couple of questions. I'll probably just go into one here on medical history. Less than 2/3 or only 59% of parents carers felt that different members of hospital staff were definitely aware of the child's medical history. So that's shown by this orange chart here, and 34% answered that this was only to some extent the case. It's slightly worse for 0 to 7s than 8 to 11s and 12 to 15s in terms of medical history knowledge reported by parents. Okay, importantly, the survey asked about the impact of treatment and care and diagnosis on children's schooling and education and sort of wider day-to-day lives. What this chart shows is, so the question asks, has your child's schooling and education been impacted by their treatment and care? 44% of parents said their child had been too unwell to attend school due to their diagnosis, and 56% had missed school due to timings of treatment and care. Treatment and care was more likely to have an impact on education for 8 to 15s, as you can see here, than the 0 to 7s, but that's perhaps unsurprising as you've got a large chunk, a third of 0 to 7s who say their child's not at school yet, so it won't be an issue. We've got only just over half of parents and children who receive care from different hospitals say that the different hospitals providing cancer or tumour care always work well together. This is quite an important one given the sort of the way that children's cancer care is delivered, and quite often delivered by multiple hospitals, principal treatment centres, and more hospitals local to the child's home. So again, I guess it's just useful to reflect on this and think about if there's anything you're doing that can improve or enhance the way you work with different hospitals. Of course, if you're from a hospital here today, or any recommendations on how we can improve this to ensure that hospitals are working effectively together to deliver children's cancer care. Not too many more results to go, I promise. So children with cancer obviously spend a bit of time on a hospital ward, either overnight stays or as a day patient receiving treatment and care on a day ward. So it was important to ask a few questions in the survey about their experiences of being in hospital. We ask about staff availability in hospital. Generally, this question was quite positive in terms of staff availability in hospital when the child needed it. Most saying staff were always available, but then we've got some saying sometimes and very few saying no. There was room for improvement identified in things for children to do in the hospital. Less than half of respondents, so only 43%, definitely agreed there was enough to do. Responses from the 12 to 15-year-olds were worse than the other age groups, so only 39% said agreed there was definitely enough to do. We know this question probably needs to be interpreted with COVID in mind. So, you know, some of the survey free text comments referred to the fact that teenage rooms and areas were closed due to COVID. So we just need to keep that in mind as we're looking at that data. But I guess importantly, if restrictions do stay or come back, it's how we can make sure children have adequate entertainment when they are in hospital. There were various other questions, for example, asking about the choice of hospital food, overnight facilities for parents, Wi-Fi availability in hospital. Those are all available separately as further data tables, but have not been presented here. Children receive care at home quite often for their cancer care, and treatment. So we did ask a couple of questions about the care received by home nurses. What we found is the overwhelming majority of both parents and children said that staff visiting them at home were always friendly. So 96% for parents of 0 to 7s, 98% for 8 to 15-year-olds. Most parents and children, look at the next question, on communication, importantly, most parents said that they could always understand what the nurses caring for their child at home were saying. 89% overall, 93% for parents of 0 to 7s, slightly lower ratings when we look at the children's responses directly, so 81% and 86%. And again, slightly lower score for your 8 to 11s than your 12 to 15s in terms of communication there. Okay, I am just doing a time check. I am okay for time, a few more minutes. Okay, we're nearly there. Overall care. So we wanted to ask, and I know David presented in his slide earlier some of the overall care statistics from the survey, but just to point out, we asked parents and children the questions which were quite differently worded, and for that reason they're not comparable with one another. So we've presented them both separately here. Children were asked overall, how well are you looked after by your cancer or tumour care by healthcare staff, and they can answer very well through to not at all well. Overall, children aged 8 to 15, 80% said very well. Interestingly, children aged 8 to 11 were more positive than children aged 12 to 15, with 86% of 8 to 11 saying very well. And for parents, it's a scale of rating their child's overall care on a scale of 0 to 10. And again, 92%, as David presented earlier, 92% overall said 8 or more out of 10. And there was very little variation across the age groups for parents there, as you can see here. And I have just one or two final overall care slides broken down by demographic information, which we thought would be interesting to share. So overall care by gender. So children's overall care was rated slightly better by girls, than by boys, as shown by the difference here, very well, boys, girls, and overall. In terms of parents, there were no notable differences in parent carer rating of overall care by the gender of their child, that is, the gender of the patient. And similarly, overall care by ethnic group. So this chart here shows the children's overall care rating question, and we can see that children from a mixed and Asian ethnic background was slightly less positive about their overall care, shown by the lower bars here than other ethnic backgrounds. When we look at parents' overall rating of care, 100% of parents from a Black ethnic background rated their child's overall care as 8 or more out of 10, and this is slightly lower across other groups. But we just need to be cautious of lower numbers of respondents in some of these groups. Okay, and my final slide really is just to signpost you to some visual summaries. So as well as the more sort of formal technical reports and the bar charts, we've got some really nice sort of child parent public friendly outputs on the website, and the website here is where you can access them. But there's about 7 or 8 of these scenes, and they talk you through some of the key findings, and these are the findings highlighted by children as important. So they're really useful for sharing some of the results if you wish to share them further on social media or with patients. And that's everything from me. I will just leave you with the further info slide in case you have any queries. You can contact us on these details. So thank you. And now I know we've got 1 or 2 minutes. I didn't know if anything had come up in the chat.
Yes, Stephanie asked a question which Philippa and Jenny have answered, but it's focusing on were children involved in the generation of the survey. But I think it's also worth saying that children were also involved in the production of the reports. Yes. If you have anything to add on that.
Yes, and I know you were partly involved in those. So yeah, so children heavily involved in the development, informing what we ask in the survey, but also as we develop the reports, and particularly the visual summaries that I've just displayed here. These were informed in terms of the design, what they look like visually, and the data that we put on them. They were guided by what children and parents told us were important, what designs they prefer, and what aspects of care they wanted to see pulled out on those visuals. So yes, children and young people are engaged all the way, and we also have patient and parent reps who sit on the advisory group as well.
Thank you, Amy. And if anyone does have any further questions to ask Amy, please do feel welcome to drop them into the chat, and we will return to them towards the end of this session as well. But Amy gave us a very good insight and overview of all of the feedback that has been provided nationally. And now I'm going to hand over to Rebecca, who will be starting to share her screen in a second, focusing here on the national free text and qualitative data. Rebecca, are you happy to pick up?
Yes, sorry, I was just trying to share my screen and get off mute at the same time. Can everyone see my screen there now?
Yeah, you might just need to put it in full screen. Sorry, Hanan. Rebecca, yeah. That's it, perfect.
You've got it there now, brilliant. So good afternoon, everyone. Thank you for having me here today. So I'm Rebecca Crinson. I'm Partner and Insight Director at Explain. We were commissioned specifically to look at the open-ended feedback, so the free text that's collected within the survey, to conduct a thematic analysis of that. Ultimately to try and identify some richer detail in terms of areas of improvement and facilitate reflection and learning across services delivering cancer care for children aged under 16. In terms of the question that is within the survey, they provided us with that data. So at the end of each of the questionnaires, there's an open question that asks respondents if there is anything else they would like to say about their child's cancer or tumour care. One question for parents and one for children. So within that open question, respondents are invited to list anything that they thought that was particularly good about their experience, and anything that they felt could have been improved. In terms of interpreting the results that I'm going to go through in a moment, What's important to note is that there were a high number of positive comments, so lots of kind of general expressions of gratitude and appreciation of the care that had been received throughout the child's cancer journey. And obviously that echoes a lot of the positive scores that have been coming out of the survey. The positive comments are more kind of general expressions of gratitude, and they are less they're less detailed. So parents and children thanking for the care received, and that staff were amazing, or really thankful to staff for providing the care that they did, but nothing kind of specific in terms of what stood out as being particularly good that could be taken as best practice and rolled out elsewhere. The more actionable and detailed comments that are within the survey are around potential improvements. So the focus on the thematic analysis is around those opportunities for learning, which are supported by the quantitative findings. So in terms of the key themes, so as I've just mentioned, lots of comments in regards to staff. So lots of comments relating to overall care and members of staff expressing gratitude towards the team that had cared for them or their child. So there's some examples of comments here. So some nurses are amazing and funny. Most of the staff are fab and caring and nurture my child. I cannot praise the doctors and nurses enough. So we saw lots of this kind of really positive feedback coming out within the open comments. What also jumps out in terms of the thematic analysis is the impact of one negative experience with staff. So when Amy was going through the quantitative findings there was that kind of bar of a proportion of people who said that staff rated staff positively sometimes as opposed to always. And when you look at the verbatim comments around staff, as I say, overwhelmingly positive, but it is clear the impact that sort of one member of staff can have on experience. So negative comments around staff were not about staff as a collective. It was typically one or two specific members of staff and the impact that had on someone's experience. And the comments highlight different qualities in members of staff that were clearly very important. So respondents looking for empathy, friendliness, kindness, someone who's approachable and someone who is attentive. Another theme that Amy highlighted within the quantitative results was around kind of joined up communication between hospitals, and that score of 54%, which we've got listed at the bottom of the slide there. So one of the core themes that came out of the thematic analysis was in relation to a need for improvement in communication, both within and between care teams and across hospitals. So that was felt to be particularly important to ensure continuity of care and a holistic approach to treatment. And in terms of how that then left the parent feeling was that obviously they were the only common point of communication between all of these different hospitals, and so ultimately they felt that they had to repeat information a lot sometimes, and kind of the pressure was on them to retain and have access to all of this information so they could share that with all of the different health professionals or hospitals that they had to deal with in terms of the child's care. So the next theme under communication is around tailored communication for parents and children. And again, this is something that Amy highlighted in the quantitative results. So some specific themes that came out around this. So the first one was a desire for parents and carers to speak to doctors without their child being present. There's some things some questions that the parents would potentially want to ask a doctor, but they wouldn't necessarily want their child to hear the answer to that question right at that moment. And so the ability to have that frank conversation with a doctor without having to worry about how their child might receive that information. There was also a theme around the information provided at initial diagnosis. And so the fact being that the parent potentially wasn't able to process that information at the timing that it was delivered. So not necessarily that there was a problem with the information that was provided or a gap in the information that was provided. Just at that moment in time, at the time of diagnosis, the parent was in a state of shock, and so absorption of that information was difficult. So there were lots of suggestions around having a recap of that information at a later date to enable that to be absorbed and the parents to be able to have a think about what questions they might want to ask. And then some children highlighted that they felt doctors used too much jargon. So all of those themes really around tailored communication for different situations, different points in the journey, and consideration for parents and children too. Information sharing, so there was a general consensus around more information being provided proactively prior to and during treatment. This was a kind of a general theme of, we would like more information throughout the journey, but there were lots of individual suggestions of ideas that would have improved the experience for different people. So all of these are fairly individual, one or two parents or children suggested them, but just to give an idea of the range of different things that could be provided. So we've got a who's who of staff members, an introduction into how chemotherapy works, an app with information about wider support that's available, information about charity, counsellor and psychologist support, information about financial support, a library of medical information and tips for parents in that situation, and more information on the cancer type, the treatments and the outcome. So moving on to support required during the hospital stay, and I think what jumped out specifically in this section was the clear difference between the younger children in the survey, so the 0 to 7s, and particularly the teenagers, so age 12 to 15. So the younger children looking for more play support and more play therapy, so improved access to therapists and for them to spend a longer time with their child. Where teenagers potentially looking for more psychological support and also time away from younger children as well. So access to quieter rooms. And I think one of the kind of themes that jump out kind of across some of the verbatim was the differing needs of that teenage audience versus the younger children specifically, in terms of the ward environment, the entertainment that was provided, and all of the sorts of factors like that. In terms of support required during treatment, again, this was something highlighted by parents and that they were looking for additional support during the treatment process, wider than the actual cancer care itself. Again, lots of individual suggestions that were provided. So that included emotional and psychological support for both the parent, the carer and the child, behavioural support for the child, sleep support for the child, nutritional support for the child, and occupational therapy for the child as well. So a range of different suggestions. Another theme that came across strongly was around a need to ensure that parents or carers are looked after as well. So responses from both the parents themselves and children highlighted the importance of this during their child's hospital stay. So lots of comments about beds not being comfortable, comments around making sure parents and carers are provided with food. So this was particularly difficult if a parent had a young child on a ward and didn't want to leave the ward to go and get food themselves. So it was something that parents commented on that they were willing to pay for themselves, but it would be good to have access to food on the ward so they didn't have to leave their child to go and get that. And an area specifically for parents, for example, a place where they could eat. In terms of food, so this was definitely a common theme that came out, particularly amongst the children. And there were several kind of sub-themes under the banner of improving food for patients. So a general need for better quality food, a need for more choice or options of food. Lots of examples of parents and carers who were leaving the hospital to buy food from somewhere else for their child and how that impacted them in terms of cost, etc. And then there were some specific comments around making sure food was suitable for cancer patients. So food that's not too high in sugar, but is highly calorific to support recovery, and also suitable for those receiving steroid treatment. There was also a theme around support required after treatment and discharge. So particularly important for both parents and carers and children to receive ongoing support after treatment had ended. So things like setting expectations about, what happens next, and providing information and guidance about the journey ahead, and more psychological support. So support for both children and for parents and carers to kind of, I suppose, adjust to their new normal of what was going to happen next, and process what had happened to them so far. And then there were several themes under what we've called wider hospital issues. So things like privacy. So this was particularly important amongst that teenage group again, and particularly female teenagers, feeling uncomfortable being physically unwell in close proximity to others. So looking for some increased privacy on wards. Some comments about generally wards requiring updates. Some comments around regulation and provision of parking. Some comments that often children had to visit non-cancer wards on occasions, and that they needed to be better equipped to deal with the requirements of this group. Comments on time spent waiting. And this wasn't sort of waiting times in order to be able to get an appointment or anything like that. It was more around time spent waiting in hospital, so waiting for a particular test, or waiting for results to come through, or waiting for medication at the pharmacy, for example. And then enforcing hospital rules. So this was things like making sure people were quiet on a night time, or making sure lights went off at a particular time to ensure that children could get a good night's sleep. And then a decline in care and services during weekends, bank holidays and school holidays as well. So there is a lot of richness and insight within the data, but hopefully that gave a good overview of sort of the key themes that we identified when going through all of that. If you do have any questions, I'm happy to take those in the Q&A a little later, or I can pick up any questions in the chat as well.
Thank you so much, Rebecca. That really did give us some richness to behind the data there, some of the direct feedback that is coming from children writing in their own words there and their parents. So thank you so much for sharing. Sonia, we are going to be heading over to you next, if that's okay. You should be ready to take over now.
Of course, let me try and figure out how to share my screen.
Yeah, and thank you for joining us today from Young Lives versus Cancer.
Can you see that in an appropriate format?
So I think it's showing your notes side. Just try going to the next. I think we can see it. It's just a little bit smaller than we would usually, but I think that's okay.
It's looking absolutely fine for me.
Excellent.
Yeah,
there we
okay.
go.
Yeah.
Right, I'll go with that. Thank you. Thank you. I am Sonia Malik, Head of Policy and Influencing at Young Lives versus Cancer, and I'm really happy to be here today talking to you, not least because this work has been a really consistent feature of my work over the last couple of years, and I'm really pleased to see how far it's come. Young Lives versus Cancer, formerly Click Sargent, if you weren't aware, we provide practical, emotional and financial support for 0 to 25-year-olds with cancer and their families. We also have a really strong policy and influencing function to advocate for system change, which will improve the experiences of young cancer patients and their families. And that system change influencing agenda is one reason why we've come to be involved in the development of the survey. So our voice and engagement team have historically brought together groups of children, young people and parents to share experiences and tell us what issues are important to them. And this feeds into many aspects of our work, one of which being our policy and influencing work. The themes that have emerged time and time again were things that we've just heard about from children: hospital food, noisy wards, travel, entertainment, Wi-Fi, keeping in touch with school, amongst others, and all of the things which broadly add up to their cancer care experience. So what to do with that information? As an organisation, we can and do campaign and influence on those specific issues. But what this particular group of themes seemed to be telling us was that children and families wanted space to share their experiences, to feel listened to know that this was making a difference and resulting in change. So along with many other voices in the sector, we started advocating for a children's patient experience survey. And as well as just saying, we need a children's cancer patient experience survey a lot over many years, we've also been involved directly in the development of the survey and shaped how it's developed. So firstly, as part of that advisory group that Amy mentioned earlier, along with other charities, healthcare professionals, researchers, children and parents, we've been there throughout the development process, from the tender process to giving our thoughts on question development and promotion of the survey. We're there to lend our cumulative expertise as a charity that listens to and supports this group. But we're also there, more importantly, to make sure that children, young people and their parent carers have also been involved in these stages. So testing the survey questions that's been mentioned already, for example. And it takes a lot of time and resources to engage children in this kind of work. So I think it really can't be underestimated at how big that is. And you never get the numbers you'd hope for. And it takes a lot of persistence and going back to all the networks to try and make it happen. So this, I'm sure this is not the clearest picture to you, but I thought it'd be really nice to show you this illustration that was created at one of our residential discussions with children back in 2018 or 2019, where they talked about what was important to them and also how they wanted to be heard. And the patient experience team came along and talked to them. So it's got things on there like hospital is boring and more things to do, being cared for, and then importantly to tell us what you've done with our information. And I'm sure if you look closely enough, there's probably food on there as well, because that always does come up. So why is the under 16 cancer patient experience survey important? So I've mentioned all these themes and issues that have kept coming up. And in the discussions, they broadly seem to fall under this cancer care theme. And it's really important that we're able to collect and access data to explore these experiences. It's important for the sake of equity and fairness. There's an adult cancer patient experience survey, and so too should there be a consistent national mechanism to gather data on the things that matter to children and parents about their care. It's also really important for visibility. So I'll share a quote from Brad Gutcher, founder of Alike. When data and statistics are missing, that means people are missing, and that's why it's important. And I have borrowed that extensively because I just think it sums it up quite nicely that if you're missing from the picture, we can't really influence and share experiences. And he said that at the Trekstock Inequalities panel discussion a few weeks ago, which is still available to view on YouTube, I believe, if anyone's interested. So it's also important for accessibility. And by that, I partly mean understandable to the layperson and to the people who have taken the survey. You don't need to be an expert to understand the results. And obviously you can get into more or less technical detail at different levels, but those national results and those great visual summaries that PICRA has created are really easy to look at and for the people who took the survey to understand what's come out of there. And also timely, so we can actually do something with the results. There's obviously a time and a place and a need for longitudinal data, but it's also really good to know what's been happening in the last year so we can make changes. Looking at the survey results, what can we see? So I'm not going to go through all the detailed results. Better Placed people have taught you through those already. But what I will reflect on is firstly those top line results, showing some really good overall care experiences. So 80% of children felt well looked after and 92% of parent carers rated experience of care as 8 or more out of 10. That really lines up with what we're hearing from children and parents, Young Lives versus Cancer, that particularly clinical care experiences and treatment is largely good, even during the pandemic, which has been really challenging. But it's that some of those experiences surrounding that care, which could be better, and social, emotional, limiting the impact on everyday life. So I'd like to then look at 3 results specifically. Firstly, 75% travelling less than an hour to treatment. So to flip that, that's still up to 25% who may be travelling over an hour. And for one thing, that's lots of families dealing with those extra travel costs. And then 45% saying that treatment was offered at a time suitable for their family. Again, over half then who are saying it wasn't. And that's an issue because the rest of your family doesn't just disappear when your child has cancer. Other kids, caring responsibilities, school runs, etc. are all there, as well as the stress of family life being so dramatically impacted. That's a huge stress that families are dealing with. And Wi-Fi, 37% saying that Wi-Fi almost met their needs of themselves and their children. Now, this might not seem like the most important one, but it really is. And I think after the last year, we all understand that more, the importance of great Wi-Fi. We sit here right now due to the good grace of my internet connection. But it's a lifeline if you're in hospital for keeping children distracted, entertained, keeping connected with school and work peers, so they're not isolated, access to banking services, and so on. It's a really vital service, not just a nice to have. And there's also a mental health impact and a social impact from not having it. It may be no surprise that I've picked out those areas if you know the work of Young Lives versus Cancer, because they are areas that really link into our evidence base and our campaigning and influencing. So what do we do with the results then? We use them to inform our influencing priorities, enhance our evidence base, and flag issues that we might want to explore with those we support in a bit more detail. For example, travel costs. With children's treatment often delivered at specialist centres, rightly so, families end up travelling long distances to a great financial cost. And we've been campaigning and influencing for a young cancer patient travel fund so that this is not the cost that families have to bear amongst the other financial impacts of cancer. And then also all those areas linking into the emotional and social impact, Wi-Fi that I just mentioned, and really interesting to hear what's coming out about psychological support and lack of signposting and greater need for it that have just been highlighted as well. We tackle these areas from 2 sides: service provision of our social workers, providing emotional and social support, homes from home, accommodation, financial support, information provision, and then also from the system change side, advocating for a young cancer patient travel fund, and we'll be making evidence gathering on access to mental health support a real priority in the next year, so we can think about and bring people together on what solutions are needed to make that provision better. So these results really reinforce the issues that we're working on and providing services to support on, and give us insight into our future directions. What is next and where do we all go to from here? The survey is not the answer to understanding all the experiences of this group. That 10 to 20% who didn't feel like they're receiving great care still have important stories to tell. And we should be looking at who's completing the survey, by which I really mean who isn't completing the survey. Who are we missing? Cancer types, ages, people from minoritized backgrounds. We need to work together to engage and build trust and awareness of the survey, explain its value, and also understand that it needs to combine with a range of methods to understand people's experiences. Some people will never be survey takers. Some people will never take part in interviews. The perfect accessible survey to all just unfortunately may not exist. So there needs to be other projects to understand the lived experiences and the nuance that surveys just can't get. And of course, I've been saying we because this is all of us, PICA, NHS England, charities, healthcare professionals, and other stakeholders, all working together with children, young people and their families. And on a final note, I'd like to mention my hopes and ambitions to see similar or equivalent measures in each nation of the UK for children and young people and adults. So that brings me to the end. I don't know if there are any other questions before I hand back over to Amy.
Thank you for that, Sonia. It was really fantastic to get the charity's view on and really seeing there the evidence and insight for the support services and the programme of work to support these children, their family and the young people who are affected by cancer. So thank you so much for talking about how these results are going to be used so effectively. If there are any questions for Sonia, please do pop them into the chat. Sonia is going to stick around and will be able to answer them directly in the chat or in the Q&A section that will follow towards the end. There's no immediate ones. I say that we pass on to Amy here, who's just pulled up some slides, and we're going to be focusing on the next steps. This was the first year iteration of the under 16 cancer patient experience survey, but it is certainly not the last, as we can hear from all the important results and how the feedback is going to be used. So Amy, are you happy to take over here?
Thank you, Hanan, and thank you, Sonia, for the fab talk. This is just one slide before I hand over to Neil. So I just wanted to sort of draw awareness to the next steps. As Hanan said, it's the first of hopefully many surveys to come. So we've just reported on the 2020 survey, and as that was being reported on, we were already setting up and preparing for the next survey, which will take place to the same timeline, but a year later. So what we're currently doing is we're revisiting the questionnaires. We're retesting them with children and with parents, because it's been over a year since they were originally developed. That will ensure the questions are understood as intended. They'll probably be refined and tweaked a little bit, tested a bit further. We're also revisiting the sampling approach, making sure that we sort of take any lessons learned forward from the first survey wave, and making sure they're appropriate. And one change going forward is the sort of addition of a certain diagnostic coding into that, so we can trial how we might make the reporting a bit better for the next survey wave. In terms of timelines for the survey then, principal treatment centres will be drawing their patient sample lists early next year, and we'll be hosting a webinar to support that in January. And the fieldwork is expected to a similar timeline to this year, that is from March onwards, with results expected late summer, early autumn in 2022. And importantly, we've got an advisory group meeting, which we are currently scheduling for February next year. That's probably going to take a sort of broader look at the survey content. I know there's been a couple of comments here about really useful comments about questions and potential wording. So any feedback, do feel free to share it in the chat or after today, but we'll be doing a wider review of the survey and the questions with the group. And that's everything from me. So Neil, I am going to hand over to you if that's okay. So Neil's going to just talk through making the most of the insights. Neil, I will bring your slide up. Thank you.
Okay, thank you very much. Can you hear me okay? My Teams has been a bit on and off today. It's working, is it?
Yes,
that's good.
Can hear you.
So
you.
Wonderful to be here, and it's fantastic to listen to all of the wonderful insight today. I just wanted to start really with the fact, I think a third of people who was invited to take part responded to the survey, didn't they? And it really shows the emotional investment that people affected by cancer have got in sharing their experiences, so that it's significantly higher numbers than you would ordinarily get in a lot of surveys. And it is quite difficult to relive some of these experiences, thinking about the positives, thinking about the things that could improve. And it is an emotional investment to do that. So it is very significant, I think, that so many people want to do that. And it obviously recognises the fact that it matters to people, and that their experiences of care matter to them. And I think that gives us a responsibility, because obviously we're not doing the survey in order to learn about how things are. We're doing the survey in order to make sure that we continue to improve, and it's only meaningful if action follows what we've heard, and people are telling us their experiences because they want us to do more of the things that are good, and they want us to address some of the things that they think could be better. So it's not the end of a conversation when we see the results shared like this. Hopefully it's a time to take stock in an improvement conversation, and I think the things that will really matter will be the conversations that happen at a local level, the conversations inside principal treatment centres, inside hospitals, and the conversations in cancer alliances and with partners in the voluntary sector. So really, this is just a plea really to take some of these findings and share them with young people, with parents who are using services, and see where those conversations then go. I suspect a lot of the issues that you have heard about today will resonate strongly with people, but some will resonate more than others. And different groups of people will think that certain findings are more important than others. So I think we've heard a lot today about some of the issues that matter to people. I'm not going to cover those because they've been very well covered by people earlier. I would, I think, as people have done in the chat, just highlight the importance of understanding the variation in response to different groups of people. And the fact that the kind of cancer, the age group, or different ethnicities, and people with other different characteristics will respond to these surveys in different ways, and it's very important to understand those differences and think about how we might narrow the gap for people. Really encourage you to look at other sources of data. So you'll have your own sources of data, whether that's qualitative, whether that's quantitative. Do these chime with the kind of things that you're hearing here? Are there any differences? All of these are really good prompts for conversation, talking to young people and talking to parents about the findings and what matters. And so hopefully the survey does fill some gaps. I think the National Adult Cancer Patient Experience Survey has been fantastic at encouraging continuous improvements. It's really good to look around. You see the majority of NHS trusts improve against a majority of indicators every year, which is really what we wanted to see. But obviously, there was a gap for young people, and this has filled some of the gap, not completely, as Sonia was saying. So we do need to talk to people and learn from other methods as well. But let's see what resonates with people in individual centres. Let's see what which of these findings is more important. Some of these things will take longer to work on and improve. Some of them are simpler, actually, to act on. And I think one of the beauties of that involvement of working with young people and with parents is that we find out what matters, we find out what works, the kind of things that we can do more of, and we often get some fantastic ideas for how we might address some of the areas for improvement. Now, sometimes that's about the issue about financial information is one that resonates with me, because a few years ago that came up in the adult survey, and we actually hadn't been asking a question about whether we were signposting people to financial information, and when we did ask that question and when Trust focused on it, that was the biggest area of improvement. So sometimes we can be really responsive to things like this, but also sometimes the simplest ideas for improvement can make the biggest difference. So I think sometimes there's a nervousness of working with young people and families, because we think that they might ask the things that we're unable to bring about, or they're going to ask the things that are going to be very difficult. Often what people are suggesting is really simple ideas that make a big difference quickly, and can also really help to share the story and to motivate people who need to support those changes. And one of the things you could do is when you talk to young people and parents, to find some stories that you could tell, either people themselves telling those stories or creating digital stories, taking those along to a quality committee, taking those along to a board. That can make a fantastic difference too. Now, the NHS England's board quality committee always starts with a patient story, and often we're talking about that story for 45 to 50 minutes, much longer than any of the other agenda items. And so they really can be quite pivotal in influencing leadership of organisations and helping people to understand the context in which we can bring about change. But I think possibly one of the best arguments for working with young people and parents in both understanding these results and in improving work is that it does such a huge amount for staff satisfaction as well. And David alluded to the context, and these are difficult times. People are working very hard. People clearly want to provide the best care that they can, and seeing that reflected in what they're hearing from patients and families and working with people to design what does that mean for us here, how we're going to deliver that together, means that you come out of improvement programs based on these methods of working together, with the patients and families feeling really involved, but also staff feeling really positive, really owning those changes, and feeling a great deal of satisfaction as a result. Obviously important, as Sonia was saying as well, to tell people what has been done, because just improving things and not sharing those results can mean that the people who've invested their time in telling us about the quality of services don't necessarily know what happened, and they don't necessarily feel that the surveys are making a difference. But I think, in summary, in conclusion, one of the real joys of working in the NHS and public services is often working with young people. They have some fantastic ideas, and often some of the real challenging conversations that I've had in my time at the NHS have come from young people who don't necessarily understand why things can't be done, but they're also looking at some really practical ideas from elsewhere in their lives that they think we might be able to adopt. So it is highly motivating. You know that from your work, and I think that there are some wonderful ways in which we can involve young people, and young people really do want to be involved. They do want to have to say, and they do want to make suggestions for how things can be better, and this is a real opportunity. So that's it really. It's not the end of a conversation. I hope it's an opportunity to take stock and to bring these the stimulus of these findings into your improvement conversations, to say, what can we do with these results? How can we respond to those people who've given us their time, the emotional investment in telling us about their experience, so that we can continue to improve and address some of the areas where we haven't really had such a strong spotlight on in the past. So I look forward to hearing some fantastic stories about improvement based on the survey, just as we have seen from the adult survey. Thank you.
Thank you very much there, Neil. Very good summary of where we're going and what the next steps are, what we need to be looking for to continue, and the value of the work that is going on here. We have come to the end of the main presentations that we're going to be sharing with everyone today. However, there are a few comments and questions within the chat, and please also feel welcome to put your hand up. We can unmute you if you would like to ask a question directly to any of our panelists today. Claire, sorry to call you out here, but I think you've got quite a pertinent comment here, especially given what Neil was just talking about regarding digital stories. Is this a plea out to everyone if they've got any? Yeah, absolutely. Thanks, Hanan. You know, we have used different stories, as Neil's just said, at Quality Committee, and it would be a great opportunity if people are or have already collected digital stories around experience of care for children. If they can be shared with us in the national team with consent, then we'd be really happy to receive those and think about how we could use those as well. Thank you. Excellent. Thank you so much. And Amy, yes, there is going to be a recording of this presentation made available that will be circulated afterwards. Steve, I can see that you have your hand open. Your mic has just been opened if you'd like to speak.
There, that better?
Yeah, there we go. Thanks, Steve.
As well, okay. Yeah, it's much easier talking through this and typing it in. A lot of the questions and the analytic framework were sort of after the event, if you see what I mean. So it's when you're in hospital, your experience of care, and afterwards. And I saw at the start there were a number of children that went straight to hospital. Other ones saw the GP a number of times before they went there. And I was just wondering if is there a lot of questions in the survey that I didn't catch about the pre-bit, the bit before you end up in hospital and things get almost taken out of your control? And is there an analytic framework as well where you start understanding different experiences depending on how long you had to prepare for them? Because I can imagine the better prepared a child is, just like an adult, the better the experience is going to be because they're more prepared and ready for it. I couldn't type that in a box, I'm afraid.
Hanan, I can pick that one up if you like. Thank you, Steve. A really interesting question. the survey starts at the point of diagnosis, so it starts at the point at which a child receives a confirmed diagnosis, which is generally in the hospital setting. So because it is a cancer or tumour survey, we only want to ask about that point onwards. So it does start at that point and then go through the cancer journey thereon through asking about treatment, follow-up care and the like. So hopefully that answers your question. It would be interesting to see if there's any differences in experience by how quickly they got seen. It's something that we haven't got readily available, but we can look into that if that's of interest. Does that adequately answer your query, Steve?
I think so, yeah. From a data point of view, I think it does, yes. It's something that I think should be looked at, because I think that there's a really important part of the care pathway that we can possibly build on. I'm just wondering if, Sonia, if that's something that your guys deal with.
So was that on the pre-hospital experience? Yes, we have done some work on experience of diagnosis. It's not a massive focus for us, but I think we really focused on the emotional impact of that pre-diagnosis experience. If you feel you've had delayed diagnosis or not a great diagnosis experience, the emotional impact of that is quite great and leads on to relationships with staff and for the rest of your treatment. So we focus on awareness for, we did some work with awareness for GPs a couple of years ago, and link into other organisations that do that work probably a bit better as well.
Thank you.
I was just going to add as well, in terms of the verbatim, the open feedback, although that part of the journey is not covered in the questionnaire, it is something that parents make comments on in the open response often, which I think just highlights it is seen as part of that overall journey, and it's a really important part of the journey to them as well. And so it was often something that was commented on within the free text.
Thank you, everyone there. We've also had a couple of comments here in the chat relating to PTC and DGH, splitting out hospital care here. Amy, did you want to pick up some of this?
Yes, sure. There's a really interesting chat going on, as Hanan said, in relation to, can we ask people about differences in care at PTCs and POSCUs? We tried and didn't come up with an easy solution for the first survey way for this, given the language of PTCs and POSCUs, or how we get children to distinguish the difference between care at different hospitals. And I think there is a comment in the chat box referring to the fact that children just often refer to their care as being at a hospital without sometimes even knowing the hospital name. It's just a hospital. However, there's some really interesting recommendations coming up, so thank you. There's the use of play and Lego to help children understand the difference between hospitals. Sally, your comment about your children referring to the PTC as the big hospital and your district general hospital as the little hospital is a really interesting way of putting it as well. So I think that certainly is something we need to explore, because I think we're hearing that a lot, that it would be very valuable to be able to distinguish the results between POSCU and PTC settings. So thank you. Any further recommendations, please throw them into the chat box and we'll pick those up.
Thank you, Amy. I don't think there are any other questions within the chat box here, but do feel welcome to drop some things in there if you have any. This is also not the last time that you can get in contact with all of us. Amy put up a slide earlier today about with some email addresses and also the website for the results, which I'm sure many of you are already very familiar with. But as we're drawing towards the close, I do just want to quickly say thank you so much to all of our presenters today for coming and sharing their knowledge, their expertise, and the valuable feedback that has come from the Under 16 Cancer Patient Experience Survey. But I also want to say a big thank you to everyone who has joined the webinar as an audience member. It's fantastic to see this level of interest in such an important survey, especially in its first year of running. So thank you all for making the time to join today, and I hope that you've been pleased with hearing some of the feedback and the results that have come through here.